Hey everyone, this is Dan Kamenstein. Hopefully you guys enjoyed the second ultrasound lab. I'm going to spend a couple minutes here going through the answers to the post-lab quiz, and hopefully this helps kind of bring everything together and explain any questions you had about the quiz itself. So just as a reminder, we had a case. So we had a patient who was severely injured after being attacked and had some significant left knee pain. And all the post-quiz questions are asking you what different ultrasound findings you'd expect to see and where you'd expect to look to assess different possible injuries. Again, our focus this block is really just on getting you to think a little bit more about the anatomy and the relationship of different anatomical structures to each other. So that's our patient. So the first question we asked was just for you to upload your 4 labeled images. And then the rest of the questions are really based around these 4 images you obtained. So again, as a reminder, you were looking at the quadriceps tendon, and then the patellar tendon or patellar ligament, depending on how you want to call that. And then you were going to upload an image of the lateral collateral ligament, and then an image of the medial collateral ligament and the medial meniscus. So those are your 4 images. And then the rest of the questions are really based around these images. So question 2 asked you to identify where you would look for a quadriceps tendon rupture in this patient. So we wanted you to identify where the quadriceps tendon was and be able to identify also that you can see the patella and then the femur behind it. So your arrow really should be pointing right at that quadriceps tendon, and that was from your quadriceps tendon image. Question 3 asked you to identify where you would expect to find a hemarthrosis. And you could use either your image of the lateral collateral ligament or your image of the patellar ligament to identify this. So as we talked about during lab, in a patient who underwent trauma such as this, if we found fluid in the joint space, we'd expect it to be blood. Hemarthrosis just means blood in the joint space. So if you were going to use your patellar ligament or patellar tendon image, we're going to look for blood sitting below the patella and below that patellar ligament. So you can see the red arrow there pointing to the joint space on that image. If you're going to look at your lateral collateral ligament image, then we would expect to see blood in between the femur above and the fibula below, and below the lateral collateral ligament. So you can see there my arrow is pointing into that joint space between the 2 bones. So those are the 2 areas that we might look for fluid, specifically blood in the joint space in the images you obtained. Question 4 had our patient coming back after several months, and now he feels that his knee is unstable even after undergoing a quadriceps tendon repair. And you find that he has some valgus instability on stress testing. Now, during the lab, we talked a little bit about varus and valgus stress, and you're going to do more of that in your physical diagnosis courses. But we wanted you to think about valgus instability being a sign of a medial collateral ligament issue. And so if the patient has a lot of valgus instability, then we'd expect a medial collateral ligament tear. And so you should have, in this question, put your image of the MCL. And here we can see the MCL and the medial meniscus below it, and then an arrow pointing to the MCL, which is where we'd expect to find the pathology in this case. And then finally, question 5 reported that our patient came back several months later, has now injured himself again, this time by being kicked in the thigh by an opposing player. And the point of this image was to get you to think about the fact that in musculoskeletal ultrasound, oftentimes, especially when you're ultrasounding extremity, we have a normal extremity to compare to the abnormal. So you can compare normal to abnormal, and that will help you identify pathology if you're not sure what's going on. And so in this case, we had a normal right leg, and I gave you an image of a normal quad muscle. And here we can see the nice normal musculature, again, darker musculature with that brighter area of fascia around it. And then we compared that to the still image here, which showed something in the muscle tissue itself. So this is something black within the muscle tissue. And I showed you a picture of this during ultrasound lab as well, but that's a hematoma within the muscle itself. So you should have correctly identified that the pathology in this case was not in the bone, joint, or tendon, but in the muscle itself. So that's the 5 questions. Hopefully you guys are getting a sense now that we're going to try to do this for every lab, is create a case, talk to you about what the differential diagnosis for that case is, talk to you about how ultrasound would help you in the evaluation of that case, and then do quiz questions that ask you to take your anatomic knowledge and make some inferences about where you would look for pathology given what you know about anatomy. So as always, if you guys have any questions, please let us know, and we certainly hope you found this helpful.